While in the past, many fatalities from infectious diseases were a major and deadly problem, today vaccines have done much to eradicate and rid the world of disease. A vaccine is a weakened or dead germ or microbe that is injected into a person to cause the person to build up defenses against that particular substance. Vaccines serve to help to prevent the outbreak and spread of diseases across the states and the world. According to the Healthy Children, in 2007, vaccines are estimated to have prevented 14 million infections and saved 33,000 lives. Healthy People 2020 says that because of vaccines and immunizations, there has been a huge drop in the number of infant fatalities in even just the past 20 years. They also say that even though there's a dramatic improvement that has come about because of vaccinations, there is a lot more that could be done to improve immunity among the general population. Several infectious diseases that are very preventable but people still die from include tuberculosis, viral hepatitis, and influenza. While the benefits of vaccination are so evident in even just simple statistics, there are some who are still skeptical and think that vaccines cause more harm than good. Some even think that vaccinating children can lead to autism or brain damage. While this fact may or may not be true, there is a much greater risk that comes with not getting the recommended vaccinations than there is with receiving them. According to Immunity, a child is 100 times more likely to get struck by lightning than have a severe allergic reaction to a vaccine. According to Healthy People 2020, vaccination saves 33,000 lives, prevents 14 million cases of disease, reduces direct healthcare costs by $9.9 billion, and saves $33.4 billion in direct costs. And Healthy People 2020 also says that despite progress, approximately 42,000 adults and 300 children in the United States die each year from vaccine-preventable diseases. Communities with pockets of unvaccinated and undervaccinated populations are at increased risk for outbreaks of vaccine-preventable diseases. One of the reasons that certain diseases are still present today is because people do not recognize the high level of importance in vaccinating their children. The areas with a lack of vaccinations are much more likely to contract diseases and have them rapidly spread into an epidemic. According to the Immunity, in 1975, Japan stopped vaccinating against pertussis. Just 5 years later, they went from having 373 cases of pertussis to 13,000 cases and 41 deaths. Outbreaks of measles, mumps, and pertussis are occurring around the United States, often among groups of children whose parents chose not to get them vaccinated. By choosing to not vaccinate your children, you are not only putting them at risk, but also the community that you live in, because you are presenting your children with the possibility of spreading the disease that they contract to those around them. When the majority of a population comply to vaccinate their children and themselves, herd immunity results. Herd immunity is when most of a people group is immune to a certain disease. Today there are millions of people who travel all over the world. Because of this, there is a great possibility for diseases to be contracted and spread throughout various countries very quickly. This is yet another reason for us to emphasize the importance of vaccinations. According to CDC, research is being done to identify groups at risk of contracting vaccine-preventable diseases, stimulate efforts to increase coverage, and evaluate how well the efforts work. According to the Healthy Children, in recent years, new vaccines have made dramatic inroads in fighting even more diseases. Another avenue of expertise is National Vaccine Information Center. National Vaccine Information Center is an organization that currently exists to provide information on preventable diseases and the vaccinations that are available for those diseases. In order to find out more about this organization and what it stands for, you can visit www.mvic.org.